think it surprised us early on how quickly people got sick, that they would literally walk into the emergency room and then be in our intensive care unit, literally fighting for their lives just several hours later.
The patients that I see, they're scared because they're afraid that they're that one person that is going to die from this disease. So I've been worried about a lot of things. So initially it was keeping myself safe. I think that was the biggest transition.
So we have door monitors at the moment that are there to make sure that you're properly putting on and taking off your PPE. You begin with putting on your mask, then you put on your gown, then you put on your face shield, then you put on your gloves. Some people go as far as to put on hairnets or shoe covers. Then once you gather all of the things, because you've got armfuls of things, because you're gonna be in there for probably an hour, and you're probably already sweating and trying to do everything that you need to for a patient.
The fact that by necessity, out of both space and trying to keep people safe, family members are not at the bedside, that's really a whole different practice for me. I'm used to practicing in the intensive care unit with the patient's family at the bedside, sitting down in a chair, talking to them about what's happening with their loved ones. Now I'm calling them on the phone, we're FaceTiming from the room, even when delivering bad news, and that's heartbreaking.
It just breaks my heart that some of these people might die alone in their rooms. It's not so much leaving for work, it's coming home. You know, at the end of your day and your car ride home, you're like, all right, what did I do today? Like, how much risk did I put myself at today? But my biggest fear, and I'm sure this is a lot of people's fear, is I would hate to be the one that spread it to all the people I love.
So I'm a father of 3. I have young kids. I have a wife that's a school teacher. The challenge has been kind of, just like with so many others, managing how to best keep family safe, how to best keep mentally still positive, and all of those things. And I think that has been an extreme challenge.
For some reason, if people haven't been personally impacted by it, it's easy to think that it's really not a big deal, or even in some cases that it doesn't exist.
I think it just creates fatigue sooner than it used to. Every patient that comes in with shortness of breath, you now have an additional disease to think about.
This has not been an easy time for our healthcare providers. They are, by definition, heroes and are showing great resiliency, but this is a difficult time.
During these times with the pandemic, we've had to restrict visitation, and to have only one visitor come to be at the bedside of a loved one when you have a family of 4 and 8. These are their last memories that they're making with their loved one, and to deny that out of an abundance of safety, it's an unbelievable conflict and tug of war of moral distress.
And I was talking to my team about how sad I would be if I was in the hospital for a month and that month happened to be the holiday season, and I had to miss hanging decorations with my husband or seeing my family members. So naturally, we're gonna go buy decorations for them in case they want to decorate their room. So trying to enjoy little things in life and remembering that some people just can't right now.
We have a great team here. We need the community to be part of that team. There are a lot of families who are going to have an empty chair at the table this holiday season. We can't do this without a lot of help. Wear a mask. Wash your hands.